All right, Chris, thank you. You know, for the last 10 years or so, we've been hearing more and more about just how very important getting the proper amount of sleep is to our overall health. Many of you are now tracking your sleep with the help of maybe a smartwatch or an app. So is it working? We're going to talk it over with our sleep expert, Dr. Joseph Ojile from the Clayton Sleep Institute this morning. And I don't believe I've ever asked you this question. How'd you sleep last night? Does anyone ever ask you?
They do. I slept great.
Good for you. Well, you know what to do, obviously. So lots of folks are wearing the Fitbits, the smartwatches, looking at apps on their phone. Is this a good tool to kind of help us?
It is a tool. For some people, it's a good tool. So it raises awareness. So Randy, we're happy about that. The problem becomes if it raises awareness and we put too much stock in it. But we're seeing this every day. It's an important topic right now. Patients literally are coming in daily with monitoring devices that they share with us. We do review those with patients. It's quite helpful for us to start making people have awareness of when they go to bed and when they get up. If you think about when the trackers started for walking and taking the number of steps, what we're slowly developing, there's two aspects to this to discuss. One is, what's the action item? When we talk about steps, it was 10,000 steps, right?
Exactly.
We had a goal. So this is, how do we develop the goals with patients? We need to sit down with them and start to go over it. The other issue is believing that they're overly accurate, so that this idea that we're measuring sleep staging and so forth. The best help is when do they go to bed and when they get up.
So you want that to be the goal, the 10,000 steps, if you will.
That's exactly right, to move towards that. We want to correlate that with some physical pen and paper things as well. We give people diaries to work on, which are actually...
Oh, how antiquated, doctor.
It is. I know it's hard to believe. We hand people paper. They don't know what to do. I have one patient who's monitoring 3 different tracking devices.
Are they all on the same track? How do they look?
Don't correlate at all.
No
Which
kidding.
is very interesting. So it just shows that we're early in the going. It's a great tool, but we're not quite there yet. And the companies are starting to look at now standardizing or trying to validate some of these things. What the public doesn't realize is they haven't been validated. So we're moving forward. We're early in the going, but it's helpful. It's a good little tool that we can use in addition to seeing your physician and discussing it.
Are we doing a better job overall of understanding what sleep can do for our health?
That is a wonderful statement, and the answer to that statement would be yes. We just need to get people to buy into the understanding.
I love that nugget you gave us about 3 devices and 3 different results. That's something to think about for sure.
It's amazing.
Absolutely. All right, if you have questions about maybe your smartwatch, your device, the app that you're using, maybe you want to go talk to Dr. Joseph Ojile and the folks at the Clayton Sleep Institute. We will link you up on our website, to their website, as well as on our Fox 2 mobile app. Thank you, doctor.
Thank you, Randy.
Good rest to you, sir.
Enjoy.
All right.